Kathryn is a lovely little girl. She's 2 and she's your typical 2-year-old. She likes to have fun, but she also knows her own mind and she is very strong-willed. 3, 2, 1, go! Kathryn has left-sided hemiplegia due to a complication at birth. This has meant that her left side is weak and she's struggled to meet many milestones, not only gross motor but fine motor. Kathryn's left-sided hemiplegia means that she struggles to do many activities with her left arm. She struggles with grasp and release, she struggles with any fine motor movement. She also tends to be quite neglectful of that side and will purposefully disregard it when doing activities. She's very, very right-sided dominant. The aim of Kathryn's CIMT programme is to give her an increased awareness of her left arm, to make it stronger and to make her dexterity better. Our goals are to give her independent grasp and release, and also to allow her to integrate her left hand into bimanual activities. Kathryn's right arm has now been casted so that she can focus solely on her left side. The cast is non-removable and she will wear the cast for the duration of the 3 weeks she is with us. Having the cast as non-removable means that Kathryn doesn't have the opportunity to use her stronger side and therefore has to practice using her weaker side. The more practice Kathryn has at using her weaker side, the stronger the pathways to the brain will be and the better cortical organisation will occur. Take the top one off. Who's in there? Oh. Okay. Thank you, Kathryn. Kathryn seems to be enjoying the CIMT process so far. Her favourite activities are probably having a tea party or using coins into the piggy bank. She's a very spirited young girl and she likes to tell us when she's had enough of activities, which is fine. And we have found that we've probably used every single toy in the box with Kathryn. Once she's mastered activity, she's ready to move on to the next thing.
Before we started the CIMT, she didn't really have any use of her hand. She could use her arm to knock things over or to point with her fist, I guess. And now we're at the point where she's actually attempting to pick things up, and some of the time she can actually manage it. The improvement it's significant already.
You can see that she's trying to do it, and the response is slow, but when she focuses and thinks about it, there's an actual thing there.
There's a difference between when she wants to do it and when you're trying to make her do it, but when she wants to do it, you can really see her movements coming.
It's kind of gone from nothing to something, so that's kind of the progress that you would want, and then to just there to build on, really.
Kathryn is now much more willing to use that left arm in activities. Before, she would completely ignore it and position herself so that she didn't have to use it, whereas now, without thinking, it is coming in to try and help with activities. She has gained some grasp and release, and that has improved in terms of the timing of her grasp and release as well. I think the main improvement for Kathryn has been the strength and the control in that arm, and I hope that with parents working on that at home, that will continue to get stronger and stronger. A hand?
Yeah.
Where's that been hiding? Where's it been hiding?
There.
In there? The things that Kathryn's gained in CIMT will allow her to complete therapy much easier going forward. We've laid some really strong foundations, and Kathryn can now use her left arm to do activities that she couldn't do before, such as grasp and release and feeding herself. This means that therapy will be easier for parents to complete moving forward.
It's gone really well. We've been really pleased. Kathryn's engaged with the physiotherapists and has worked really hard, We're definitely seeing some improvements in her fine motor skills and her strength, so it's gone really well.
Yeah, that's the biggest thing. You can actually see the progress. It's not just that you hope it's there, it's actually, you can see it in the video and the kind of activity she's doing, she's making real progress.